Now I'm looking for AI.
All right. Rochelle and Kathy, are we ready?
Yeah.
Okay, perfect. All right, it's 11 a.m. Good morning, everyone. We're calling the Texas Early Learning Council meeting to order. I'm Reagan Miller. I'm the Director of Childcare and Early Learning at the Texas Workforce Commission and also Chair of the Early Learning Council. Um, Thank you, council members, for being here today for our quarterly meeting, and to the audience members who are joining us. We are hosting this meeting as a Zoom webinar, and council members and presenters are participating as panelists, while members of the public are able to participate in listen-only mode. So as a reminder, please keep your electronic devices on mute when you're not speaking. Rochelle will also help manage us if we forget to mute ourselves. Rochelle is the Quad Agency and Special Projects Director here at TWC, and she's serving as today's meeting facilitator. We have a very full agenda today, members. So just want everyone to be mindful of all of the topics that we're trying to cover in our 2-hour time block. We do have public comments today. The deadline for submitting written comment closed at 5 p.m. yesterday, but members of the public can request to provide oral public comments today by emailing their request to Catherine Davis. And I believe we are going to drop those instructions into chat so folks can see how they can register to provide public comment if they would like to. So, Rochelle, can you confirm if we've dropped those in chat?
I am working on it right now.
Okay, thank you. So today's agenda on the next slide. All right. So as we always do, we'll go over the minutes from the last meeting, public comment. We'll have updates on the strategic plan, updates from members, updates on early childhood events before we adjourn. And so with that, we are going to go to the approval of the minutes. Members, if you can find the January 2026 meeting minutes, you received a copy of those in your email. And I'd like to see if anybody has any edits or changes that they would like to recommend to those meeting minutes. Okay. Do we have a motion to approve the January 2026 meeting minutes?
This is Stephanie. I move.
So Stephanie, were you moving for approval?
I was moving for approval. Yes.
And then a second from Jennifer?
Jennifer Stockemer, yes, I'll.
Okay, so we have a motion and a second. Pending any discussion, which I don't believe we have, we are going to turn it over to Rochelle for a roll call vote of the minutes, which will also serve as our attendance count. So Rochelle, to you.
Thanks, Reagan. When I call your name, please reply either for, against, or abstain. This vote will also serve as the roll call for this meeting. So let me start with Shruti Aris-Mendez,
For.
Weldon Beard, April Crawford,
For.
Alferma Giles,
For.
Becky Huskeiler,
For.
Kim Coffrin,
For.
Beatrice Mata, Reagan Miller,
For.
Maricela Nava,
For.
Stephanie Rubin,
For.
and Amber Scanlon, who I believe she was unable to attend today. So, Kirsten Schwab
For.
and Jennifer Stockemer.
For.
Okay, I think that, oh, nope, sorry, Megan Young. Sorry, I didn't scroll far enough.
For.
Thanks, Megan. Okay, so I think the motion to approve the January 2026 meeting minutes has carried, and we've met our quorum.
Wonderful. Okay. So our next agenda item is public comment, and Rochelle, you will also be facilitating the public comment portion.
Yes, thank you, Reagan. As a reminder to everyone, Early Learning Texas has a section called Meetings. This houses all of the meeting information for past and upcoming meetings, as well as the agenda once it is released. Public agendas are posted prior to the meeting date, along with instructions for submitting public comments. As of this morning, we have received 2 registrations to provide public comment. So I will call upon each of the people that have registered. When I do so, please provide your name, your organization, and the agenda topic you're commenting on for the record. Each speaker will be allotted 3 minutes to provide the public comment. When you hear a chime sound at the 2-minute mark, this indicates that you will have 1 minute remaining to wrap up your comments. And council members may ask questions after each speaker concludes. So we can start with Lacey Beasley, who is with Opportunity School and early intervention specialist there. So
Hi,
Kathy,
good morning. I'm,
good morning.
go ahead. Can you hear me?
Yes, we can.
Okay, perfect. My name's Lacey Beasley. I am the early intervention specialist for Opportunity School in Amarillo, Texas. We serve birth to 5 years, and we're a 501c3 nonprofit. We also partner with Head Start and Early Head Start. The things that we do to navigate inclusion in our center is we do lots of screeners, we do space for therapists to come and work, and then we also do tons of referrals to our amazing community partners, including ECI, the ECSE program within the ISDs, private therapy, parents as teachers, developmental pediatricians and psychologists for diagnosis. And then the barriers that we are finding are that lots of the kids that we send over for referral to ECI, they're not qualifying for ECI eligibility due to their standards, and then they end up not being transitioned as a result of that to the ECSE program without lots of coaching and case management, and that's something that we do provide. Parents can also decline that transition, and so sometimes they don't know the importance of it, which is kind of frustrating. And then ECI is also just sending families to the pediatrician for private therapy referrals rather than going ahead and holding their hands and making sure that they get over to those private therapy places, and so they're often falling through the cracks. And then that ECI program only lasts till they're 3 years of age, and as we know, children don't generally disappear at the end of 3, and so that's kind of tough. The another barrier we're experiencing as far as CCS funding, we are looking into that higher level funding, but it has to be accessed by the family instead of being able to be initiated by the child care center. So a lot of families don't know how to navigate that process, and they really don't have an incentive to do it. They don't ever see that money. It just wouldn't make sense for them to go through the hoops to do it all. The amount of funding that might be available to us, we could potentially hire a shadow, but the child care center business has lots of turnover and call outs, and then I'm afraid that we would end up using those professionals in other areas. The ECSE programs, it's a half-day program, often for our 3-year-old students who qualify. We're seeing that we're really struggling with their breaks, that they're closed for their breaks and their long summer. And so we're either left holding the bag all day for that, or parents are just not able to work with for those higher need kiddos. And parents lose their jobs, and that's a huge issue. Parents are very overwhelmed navigating systems of referral. We provide that monthly case management to help with the accountability and coaching through all of it. And then we're also seeing that the referral, evaluation, and enrollment processes take such a long time. For the ECSE program, for example, it's 15, 45, 30. They've got 15 days to obtain consent. They've got 45 days before they have to have that evaluation done. And then they have 30 days before the ARD has to be completed. And that's business days. That's not just, that doesn't include weekends and breaks. And so we're trying to cope without a life jacket, essentially, for, potentially 4 months before we get them through that whole process. And it's a long wait period, and it's hard.
Yeah, thank you, Lacey. I think we've met our 3-minute time limit.
Okay,
and
sorry.
no, we certainly have a full agenda, or it wouldn't be quite as much of an issue today. But if there's additional information you want to provide, you're happy to submit that to us. We'd be happy to review it in writing. So thank you, Lacey. Appreciate you. I think our next, oh wait, does anybody have any questions for Lacey? Sorry.
I just have a quick one.
Sure.
Oh, yeah, Lacey, I just wanted to, your testimony is really helpful. And I know the 2310 strategic plan by TEA, it's very relevant for that process. So I hope that you will be able to share it when in a written form or in person. We'll hear a little bit more from TEA about their process, but I hope that you'll be able to share information in greater detail with them so that they can think about these transition issues, which is their charge through that strategic plan.
Sure,
goal.
absolutely.
Okay, thank you.
Okay, so I appreciate you so much, Lacey. I think we have another commenter. Originally, she also did submit something in writing that I believe members you should have received this morning. But I'm going to call on Tessa Gayoso, who is a policy associate for health at Texans Care for Children. Tessa, can you?
Yes. Can everyone hear me all right?
Yes.
Yep.
Okay, great. Hello, everyone. Thanks for the opportunity to speak this morning. My name is Tessa Gayoso, and I am the policy associate for our health team at Texans Care for Children. And I was going to provide comments on agenda item number 4. Today, I really wanted to just share some high-level themes from our recent family engagement efforts, where we talked to over 20 families across Texas whose children have participated in ECI and either have transitioned out of ECI into early childhood special education services or have just transitioned out of ECI in general. And really, the goal of these conversations was to understand barriers to families accessing ECI as well as ECSE and some of the challenges that they face during that transition. We also talked to parents about where there are opportunities to strengthen the multiple systems that these parents are encountering when they're trying to access these interventional services for their children. So I think the first thing across the board was that families described ECI as life-changing for their child. Parents spoke about the strong relationships they built with their therapists and saw real, tangible progress their child was making. We had one parent even share that a lot of their physical milestones wouldn't have been made possible without ECI. But just as importantly, they also talked about how ECI helped their entire family how to work together and support their child, especially including the siblings into that conversation and coming up with creative ways for them to play with their sibling. So given the strong appreciation for ECI services, a lot of families wish that the services could last longer. They consistently spoke about the level of support and coordination they experienced, and that was true for ECI services taking place at home, but also at their childcare setting. I think that collaboration between providers and caregivers made a real difference to these families. However, when the children transitioned out of ECI, that sense of coordination often wasn't sustained. It's a transition to new providers, a new learning environment, a new system, sometimes a new state agency. It's extremely challenging for families. And a lot of them described the admission, review, and dismissal, also known as the ARD process, as complex, overwhelming, especially when having to develop and implement their child's IEP. we had parents or heard things like, I didn't have the right questions to ask, or I didn't know what questions I should be asking. A parent we spoke to who works in special education said, I couldn't imagine being a parent navigating this transition without any prior exposure to special education. Families also shared that early SPED options didn't always align with their child's developmental needs or family's logistical realities. One parent was offered services that required busing her 3-year-old child to and from the school district back to their childcare facility in the middle of the day, and that ultimately wasn't feasible for their family. And so I just wanted to mention these themes to really point to opportunities to strengthen continuity, improve family support navigation, and kind of better align services with the real needs of children and families here in Texas. So once our team wraps up our in-depth analysis, I'd be happy to share out the findings with the council. But just wanted to share that today as an initial themes takeaway, and say thank you for the opportunity to share today.
Thank you, Tessa.
Thank you so much, Tessa. I appreciate that. And you did perfect on your timing. Y'all,
Thank you.
I don't think you can hear my timer. I tried to connect it so you guys could hear it, but
I was trying to keep an eye out for the timer, so I appreciate that.
no, absolutely. Absolutely. Appreciate you. Members, do you have any questions for Ms. Galloso?
I don't have questions. I do always appreciate hearing those great opportunities for ECR partnering with our early learning childcare programs to ensure we've got that continuity across different aspects of the early childhood system. So that's always great to hear.
Reagan, can I just bring up one question maybe you can address a little bit later? Was the Lacey's point about the differential childcare rate and what that stands for and what that means? Just maybe for later on, you can explain that a little more.
Yeah, I mean, we can just do it now. So
Okay.
there is an inclusion rate for children with disabilities through the Child Care Services Program. So there's paperwork that needs to be filled out that confirms that they are an individual with a disability. And then a rate of up to 190% can be approved for those children. So it's almost double the rate. A little later on, we're going to have an update about a new initiative, the ELITE initiative, that's aimed at providing some technical assistance around this issue.
Okay.
So you'll hear some updates from TWC in a little bit
Okay, great.
about this from Kathy.
Thank you.
You bet.
Hey, Reagan, I think that's all of our public comment.
Okay, then thank you. I always enjoy when the public comes to share their views with us. So thank you very much for being here. Okay, we have updates now. Our Texas Early Learning Strategic Plan. So as you guys remember, we developed this plan using our funding from our last PDG grant. There are 4 goal areas. So you'll see on the next slide, a reminder of those 4 goals that are contained within the Early Learning Strategic Plan. And we've been providing updates to the council during our meetings on aspects within each plan. I also want to remind you that in your meeting materials, there's an attachment that contains an overview of all of the goals and strategies within the plan. Obviously, we don't have time to talk about all of those at our meetings, but your written documents do contain information reflecting all of the strategies in the plan. So today we're going to hear from 3 folks. First, we're going to hear from Dr. Dorothy Mandel, who's going to provide an update on some strategies related to, gosh, I've got all these goal 1, strategy 1.1, 1.4. I don't know what all of these are. I think we're just going to have to hear from Dorothy because I know she's talked to us before on all of the needs assessment that she's done, and we're really excited to be getting updates again as we look forward on. Oh, good. Here's our slide on the action items that we'll be discussing. Wonderful. Dorothy, I'm going to turn it over to you.
Awesome. Thank you, everyone. So what I'm going to do today is provide an update based on the PDG Birth to 5 Needs Assessment update that we did and finished back in December time right now. And what I would like to do is kind of provide a deep dive into specifically what I think is really relevant to goal 1 and goal 2 around meaningfully involving families and also how that translates into workforce retention. So let's go to the next slide. I just want to give everybody a kind of back everybody else up into the systems level framework that we used for our needs assessment. And across our needs assessment, what we did was assess needs at 4 different levels. That's also the infrastructure level of what at the state level, the infrastructure, the quality standards, the workforce development, all of that is happening. At the community level, what we're really looking at is the early childhood coalitions and how they are working well together. And of course, the PDG had an entire strategy dedicated to enforcing and building up the early childhood coalitions. What I'm going to focus on today is really focused on local organizational issues as well as family issues. And that is that in order for families to benefit from our early childhood systems, what we see from the literature, what we know is the programmatic activities that are being done in our local organizations need to be easily accessed by the families, need to be high quality, and need to be sustainable. Also, our families need to be meaningfully involved and supported by these local organizations in order for them to feel the benefits of those particular programs. Next slide. And so for us in the needs assessment, what we did was operationalize what we think meaningfully involved and organizationally supported means to families. And that really comes down to 4 different things, is whether or not, 4 different things, whether or not families feel like they trust their early childhood serving organizations. And in what I'm going to be talking about today, I'm only going to present data on childcare, but it really applies across the entire early learning system, the entire early childhood system. So do these organizations respect the privacy of families, and are they sensitive to the needs of the families? The other thing that the way we operationalize organizationally supported and meaningfully involved is whether or not the family feels like that organization is a partner in their child's development, that organization is helping support their child and helping support their child develop optimally. Part of that too is whether or not the parent feels supported as a parent. And these are 2 different things that we can kind of differentiate. They're, of course, completely intertwined, but at the same time, we can measure these things very differently. And that is, like I said, whether or not they think the organization is supporting their child's development and whether or not that organization is supporting them in their journey as a parent. Next slide, please. So we did a family survey. For those of you who helped us, thank you. For those of you who endured our massive bot problem, I very much appreciate you. But we distributed this survey through several state agencies, our partners, our local community organizations. We provided compensation for our families for their time. It was a lengthy survey. They were eligible if they had a child younger than the age of 6 and they lived in Texas. So we took out all sorts of things. They completed the survey too fast. They didn't provide a cent to us the survey. And also, we also did a deep dive into their answers to understand whether their combinations of services, income, disability status, and childcare options were realistic based on the way the system works here in Texas. And we actually excluded a bunch of people because that combination wasn't realistic based on what our system looks like in Texas. So the next slide is going to show you our respondents. So based on, after all of our cleaning, we're right around 2,000 respondents that we're analyzing. About 1/3 of them have a child with a delay or disability, and the rest of them do not have a child with a delay or disability. We have a very good income distribution across all of our respondents, and our income distribution is slightly higher than in our first needs assessment, and that is that we have more people in that $40,000 to $60,000 range and that $60,000 to $80,000 range than we had in the first needs assessment. But this also tracks with the way poverty is decreasing in Texas, and childhood poverty decreasing in Texas. So we have a little bit more of those middle income families. And I want to point out, for those of you who are not like understand these income levels quite like I do, at the $40,000 range, anybody 40,000 and below is going to be Medicaid eligible if they only have one child. If at the 60,000 and below, they're going to be Medicaid eligible if they have more children. So we're looking at a family of 3 versus a family of 4 in those particular income levels. So even as we're pushing up in income, we're still in that Medicaid. A heavy proportion of our respondents are still Medicaid eligible. Next slide. So the first thing I want to talk about is how families are doing mentally and stress levels wise. It is clear, and this is no surprise to anyone at all, that stress is highly related to income. We see stress decreases with higher income, and this is really in our data small and significant effect. Where we really see the issue, and I think that this is relevant to all of you, is where we really see this relationship is between stress and financial insecurity. And the way we've measured financial insecurity is not an issue of what is your income, but is an issue of, do you think you're going to make your bills this month? Do you have enough money do you have health insurance? Are you worried about being able to go to the doctor? Do you think that you're going to be able to pay rent? Those issues about not just what is your income, but are you able to make ends meet, is what we're going to be looking at, and that is financial insecurity. The nice thing about financial insecurity is that financial insecurity can be lessened without raising somebody's income by engaging in services. So childcare subsidy, for example, is very much shown to increase financial insecurity. Utilization of WIC services, utilization of ECI or Medicaid can help decrease financial insecurity without increasing income, because the income that they have can go further because of that. So we're going to be talking a lot about financial insecurity here. So I just want to make that particularly clear. All right, next slide. So like I said, what I want to focus on is really childcare today, but with that, for everybody else who works across the entire early childhood system, I'm going to say that these same effects that we're going to show you really is applicable through the entire early childcare system. So we asked parents, caregivers, is your usual childcare the care you prefer to have? And we asked them what their usual childcare is, what the childcare is that they use most of the time. And we asked them if that one that they use most of the time is what they prefer. And 32% of our samples said that they were not in their preferred childcare. Huge difference between whether or not the family had a child with a delay or disability. If they did have a delay or a disability, 56% said they were not in their preferred childcare. 18% if they didn't have a child with a delay or disability. And I don't think this is surprising. The magnitude of this may be, first time we put a number on this, but we know it's harder for families who have a child with a delay or a disability to find high quality, good childcare, and childcare that works for their kids. So this is quite big. One of the things that we see is that 70% of those who are not in their preferred setting, so we take that 32% out of the 2,000 and look at them and say, well, what do you want to be in? 70% say what they want is just a higher quality childcare center. They're already in a child care center. They want a better child care center. So a lot of what families are looking for isn't necessarily like, I want it free, I want this, I want that. They want something higher quality. That's what they're looking for. That's what they want. So let's go to the next slide. So one of the things that we did is like did a deep dive around, well, let's look at the associations of what predicts that somebody is in a preferred setting. Well, of course, not having a child with a delay or disability definitely predicts that. But one of the things that we see is receiving a child care subsidy was associated with being in your preferred child care setting. So that is awesome. Lower financial insecurity is also predictive of being in a childcare setting that is preferred. So we know childcare subsidies reduce financial insecurity. So these things also are additive of receiving the childcare subsidy. That decreases your financial insecurity, allows you to help find better childcare. So that was a really great finding that we have in our needs assessment. So let's go to the next slide. So what we did is to go back to that idea of what does it mean to be meaningfully involved, meaningfully supported, and involved in your early childhood system, this is where we see the consequences. Those who are in the preferred setting had a higher belief, a significantly higher belief that their provider was a partner in their child's development. And we know from other work that we've done through the first needs assessment and through the PDG evaluation work that we've been doing, that knowing that your kid is taken care of is what makes you believe you're in a high quality childcare center. We also see that higher quality of life is associated with being in a preferred setting. So that is that situation where parents also feel supported in their parent journey, as if they're in a preferred setting. And we see just generally greater trust in childcare generally if they're in a preferred setting. So not being in that preferred setting or feeling like you want to be in a higher quality setting does have not just ramifications for how you're interacting with that particular childcare center, but general trust in that early childhood system is one of the things that we see. So that leads to the next thing of like, well, then let's back out of what families are talking about and So to go back and summarize the family stuff is that when we look at the system's level impact on family health, feeling supported, feeling less stress, feeling good in society, stress is really common, and stress can make systems worse. Systems can make stress worse, and systems can actually make the stress better. Families that want different childcare often want something better, and families what they perceive as better. And families in non-preferred settings tend to be financially insecure without a subsidy, have a child with a delay or disability, and not feel supported as a parent. And they also have eroded trust in childcare. So like I said, this kind of sets up this bigger picture of this wanting to be in something else, kind of having a negative interaction with the system that you're in now, and that leading to all sorts of problems within the family, including higher stress. So let's back out and then talk about what's happening on the childcare side and going into analyzing childcare practice and a deep dive into childcare practice. And so one of the things that we did on this needs assessment that we did not do in the first needs assessment is we specifically asked directors, owners, supervisors, whether or not they have asked a child to leave their center in the past year or their organization, because not all of them are centers. So we're specifically asked about expulsions. In the family forum, expulsions, for those of you who don't remember, in PDG for the needs assessment, our team had our own family advisory group that helped us on the research side of things, of what was important to them, and that research got translated into our second needs assessment. Expulsions was our huge conversation in our family forum, both from the perspective of even among parents who felt like their kid was at no risk for being expelled, they still felt there was a lack of clarity and transparency, and fear of expulsion for age-appropriate behavior was rampant among our family forum. When we discuss the same slide on childcare, it's a major source of stress and concern in childcare. Many of the childcare centers that we have talked to do not want to put families in that position. They really, really do not. There's not a childcare center that I talked to that was like, yeah, we'll just kick them out. That's fine. Doesn't matter. They don't need to be here. Most, especially those who are taking the subsidy, do not want to put that family in the tough situation. They know that creates a major, major barrier for the family to even continue working, to do anything. However, it is also a major concern and stress for them about what it's doing to their staff to have a child who isn't safe and the staff can't handle the safety concerns. And a lot of the childcare directors that we have talked to have major concerns for their child and really, really just super care about what is going on with the child that leads to that kind of behavior. So what we're going to do now is take a deep dive into expulsions on the childcare side, because this of the outcomes that we have in childcare is probably the most extreme outcome that we have. So this is our data just from our childcare organizations. We have 115 unique childcare operations. Those of you who can do quick mental math can see that we clearly have more than 115 respondents. Many of our childcare operations had multiple directors, sites, or had multiple supervisors responding. So we're looking at 48 who had, of these who had at least one expulsion. And then the rest of them did not have any expulsions in the past year. So we're only asking them specifically about the past year. So as you remember, one of the things that we did with the Family Forum is we developed a much more extensive list about difficult behaviors that our Family Forum felt were really important for not just putting their kids at risk for expulsion, but also things that they're worried about and that they would like to see childcare be able to handle. And one of the kind of concerning things is that we found no significant relationship between how comfortable a center was with handling these really difficult behaviors and expulsion. So as much as so we're going to dig into this a little bit more because that was surprising to me. Absolutely. And I'm going to be honest with you. I did some things I'm not so proud of, trying to make that understand why aren't these behaviors related to the expulsion rate. We even took and just dug down to the 4 big ones that the Family Forum said were the worst ones that almost always result in expulsion, which is damage to property, harm to other children, elopement, and lack engagement in group activities. We even looked at those. We looked at each one, and no, nothing seemed to predict expulsion at anything that we were willing to talk about. So instead, what we did was backed up and let's look at the directors, let's look at the owners, and let's see what is related to expulsion. And what we've started doing is now putting together a bigger model related to what we see as risk for expulsion. Let's go to the next slide. The biggest factor that we found related to whether or not a child had been expelled in the past year is actually the stress level of the director, the person who is answering the survey. So specifically, we looked at stress related to child and parent behaviors. So we have a big stress survey about workforce stress, and we specifically looked at those behaviors that were related to the child behaviors. Things like the child has more things going on that I know about than I can handle. Child's behavior is bigger than a child's bad behavior is bigger than anything happening in my center. I can't get parents to cooperate with me on behavior strategies, or parents aren't consistent with their kids. stress related to the child's behavior and the parent's behavior. And what we find is that is a huge predictor of expulsion. The other is the capacity of the center. We see expulsions happening more often as the centers get bigger. Small organizations, we do not see expulsions very often in those smaller situations. With that, I also want to say that staff burnout, the burnout of the owner or the director, is also related to expulsion. And one of the things that we see very clearly is this burnout is highly related to those child and parent stressors that we see within our stress, within our family, our workforce stress questionnaire. So let's go to the next slide. Now we will back up and say, okay, well then what is protecting that stress related to that workforce stress, that burnout stress? And one of the things that we see related to that is they accept the subsidy. And this is where we see staff comfort with those difficult behaviors, is when staff have very little comfort, when they see that their staff does not have a lot of comfort in their behavior, we see that those directors tend to have higher burnout scores. They also tend to have higher stress scores. The general stress of the director also is related to their workforce related stress, and their ability to how much they feel like they have control of their job is actually really protective of especially burnout and related to these stressors. So when we talk about the comfort with those really difficult behaviors, I don't want you to leave with the idea of like, it's only how the director feels at this moment in time. That staff comfort has a huge impact about how the director feels. But that staff comfort isn't what's directly in our data isn't directly predicting expulsion rates. So when we look at how to prevent expulsions in childcare, how do we build this kind of situation? It's one thing that I think is clear from our data is that this is more than just teaching and classroom behavior management. And this is a lot about building interpersonal relationships, helping directors manage their own stress. One of the things that we did do is we went back and said, well, does this happen with the teachers? Do we see the same thing with the teachers? And the answer is no. This is really at the level of the director, because the director, owner, and supervisor is making that decision, not the teachers. They're making the decision to expel. So helping them manage their own stress. They're also the ones having the conversations with the parents. So helping them build and better have these really difficult conversations, and also building those relationships from the beginning. So external support, we also know, is helpful in these situations. So coming in and providing more timely and quick therapies for the child. When we talk to directors, it's hard to wait 3-4 months for somebody to come in to do therapy that's going to take another 3 to 4 months to start making a difference in the child's behavior. So timely therapies for the child, and also external support on mediating the relationship with the parent as well. It's one thing that we are seeing through a different project is these directors are people too. And this is an interpersonal conflict, and it's hard for somebody to break the emotion in that interpersonal conflicts. So having an external person helping with that relationship building with the parent. We think based on our data, these things can help with the prevention of expulsions in childcare. So to go back to families being meaningfully involved and organizationally supported, this is a stress medication. Managing stress and relationships for both the child care director and the parent caregiver is a meaningful way to move forward, I think, with parents feeling supported, and also those child care directors and owners feeling supported. And it's a reminder that the home is not an isolated ecosystem. What happens in the home doesn't stay in the home. What happens in the home spills over into childcare. Also, the child care center is not an isolated ecosystem either. Whatever happens in the home also happens, whatever happens in the child care center also will spill over into the home. So recognizing that these ecosystems are very tightly tied to each other and that what affects one is going to affect the other. So that is it for me. I am happy to take questions.
Council members, questions or comments?
Reagan, this is
Stephanie.
Kim. Oh,
Hang
go
on.
ahead,
Kim, I'll come to
Stephanie.
you second. Stephanie?
Oh, hi. Thank you, Dorothy. Couple of questions. One, you did have a slide that indicated, I think, that having some early childhood consultation helped, right? Was there a slide that indicated some of the
Yeah.
whether they were expulsions or the comfort level was better through that
Yeah,
model?
and that is on the needs assessment that I gave you guys in December at the last meeting, is that those difficult behaviors, we see that there's higher comfort with some of those difficult behaviors with consultation. So there's a
Okay.
protective aspect to consultation coming in.
Right. Do you, in terms of the kids, and maybe you don't have that in these data, but were they more likely to be expelled if they were kids with disabilities, or they were older or younger, or did you get at any sort of family characteristic that might lead to more likelihood or a disproportionate amount?
Not in these data. All we
Okay.
did was we asked the directors if they had or hadn't. We didn't want to dig in too much more.
And then my last question is, do you know whether any of the directors talked through a process where, like, did they have a process like meet and sit down with the family and then try certain strategies like before they would get to the expulsion level? Was there some, it sounded like from the parents' perspective, clarity about what that process would look like would be helpful, but just so that's not a sort of an immediate response necessarily, of course, unless
Yeah.
it's a safety issue. But
Yeah, and I on the parent side, what we heard from our family forum is that when they walk into a child care center, it's not clear what the expulsion policy is.
right.
And so that's a little bit different. And in childcare, when I talk to childcare, they don't want to have a clear expulsion policy because they actually want to do all these things. My experience currently with childcare that we're working with both through the ECHO and that we've done through PDG is they're bending over backwards. So I don't want to make it look like that they're just dismissing people, they're just
Right.
dismissing kids. They really like internalize it. It is a tough choice for them. I mean, we just on our ECHO last month, we had a child care center. We actually talked about like if we don't get help, we might have to ask this kid to leave, kind of situation. And they have been working for the last 6 months to help and to help this child, all sorts of things. So I think that it is, and that adds to the emotion of it.
Yeah.
The child care director is bending over, doing everything. They're doing tap outs. They're doing all sorts of things. This one particular kid gets to actually spend time in the child care director's office for 3 hours a day because it helps him. And they are doing all of these things and they're not working. And that one of the things we very much see and what is very clear when I look at these data is that adds to that stress level and stress level and stress level. And
Yeah.
you get
I mean,
to a
it strikes
breaking
me
point.
yeah, like your data about the comfort level, like I would
Yeah.
guess that a child care educator, not the director, but who's newer in their profession might have lower comfort.
Yeah.
but that may not lead to a higher expulsion rate. But I mean, there are obviously good behavioral, TA and professional development opportunities, but when there's churn, that may
Yeah.
be an issue. Did the sort of experience level come up as an issue or no?
No, not in these data, because we have seen a stabilization, in especially in the childcare, organizations that responded to our needs assessment. We have seen stabilization where we're not seeing quite the churn. And the director, usually at the director and ownership level, we're not seeing a huge
Right.
churn.
Yeah.
So that can also be added to it, and something that we can't quite model quite right. I'm going to be honest with you. We can't quite get it right. Is we don't know if that stress for the director is higher if they have more teacher turnover.
Okay. Thank you.
So that's unfortunately something that our nesting didn't work out enough for us to be able to analyze that.
Thank you, Dorothy. Just so good to see the data that so many of us are currently living or have lived in previous past, and having been a director and having to make that tough decision is, you're right, it is so personal, and so it's like as a director, you feel like you are failing.
Yeah.
And then also the stress level of not kicking a kid out, even though you're getting pressure from parents, particularly around biting in the toddler room, right? I used to tell parents all the time, if I kick toddlers out for biting, I wouldn't have a toddler classroom.
Yeah.
But then dealing with that stress. The question I had for you was around the parents that were satisfied, like we're in the preferred childcare center, and around the kids with that had delays or disabilities. You talked about when you pulled out the 70% that when you asked what they would prefer as higher quality, what was that correlation with kids with? I was curious to see what if there was the parents that had kids with delays or disabilities were a higher percentage of like they wanted higher quality because they felt like my presumption is that they felt the centers weren't equipped enough to take care of their child's needs. So I was just curious if I understood that right, and what that
for
pulled out to be.
that, like whether they have a delay or disability doesn't differentiate who
Okay.
wanted higher quality. So
Okay.
even those who didn't have a delay or disability, if they weren't in their preferred setting, they wanted higher quality. 70% of them wanted higher quality. The thing that we see with developmental delay and disability is everything affects those families more. So the impact of financial insecurity, it affects them more. Their stress levels are higher if they're financially insecure than what we see in those who don't have a child with delay or disability. So everything just gets elevated.
Yeah.
And blown up in those families. So the bad things are badder.
Worse. Yeah,
Yeah.
exactly. Yeah.
I'm going to use the terrible word, and I'm going to use the strong word, and I'm going to say badder.
Thank you so much for your research. I really appreciate you.
No problem.
I was also interested in that 70% said they wanted to be in a higher quality setting, thinking about how we've been implementing Texas Rising Star. About half of all providers are Texas Rising Star. And when you look at the license capacity, it's over 500,000 slots that are now high quality, benefiting all children, not just those in receiving a CCS scholarship. So, hopefully as we continue to expand those Texas Rising Star programs, all of the parents in Texas benefit from that. Members, other questions for Dorothy?
I would actually just kind of like to make a comment if that's possible.
Absolutely.
Dorothy, thank you so much. I'm so excited to see Director Voices shared with the group. I'm Jennifer Stockhammer, the owner and director of Ivy Vine Preschool, and I represent childcare owners on this panel. So thank you. And one of the things that stood out to me is you mentioned that the expulsion process might not be explicit to parents. And I'd kind of like to just put the thought out there that while I address that in a handbook as required by high quality standards, we almost don't want it to be like if your child bites 3 times, you're out, because then when we have a situation and we are trying to work through it, if a child bites that 3 times and the other family of the victim, the child that's been bitten, is like, well, why is that kid still in school? Your policy is XYZ. So why aren't you following your policy? So that it really gets to be a sticky situation either way. So we kind of like to be flexible to give us the opportunity to work with the family and work through the situation, biting, hitting, pushing, throwing chairs, whatever it is. We don't really want to have that strict 1, 2, 3, you're out. We want to have the opportunity and be recognized for taking that opportunity to help students and families when we can, instead of just being like, done, you don't meet the criteria any longer. So there's a lot of, I think, a lot of nuance that goes into that decision, not just, we don't want to have a policy. It's that we want to be as flexible and accommodating that need as possible.
Absolutely, absolutely. And that's absolutely we heard on the director side. And on the family side, when we took that back to the families, especially our families that have children with delays and disabilities, actually echoed it. And we're like, I'm actually glad you didn't have a really good policy, or else my kid would have been kicked out like ages ago. And I want to emphasize that of this is not a place where I think that family want for a clear policy actually is a good thing. I agree. Yes, everything you just said, Jennifer, we heard it so many times from our
Great.
director.
I'm glad that the kind of the general experience is very similar and it's coming out in your research.
Yeah.
Again, I have one more question if we have time. Dorothy, on your measuring of quality with parents, did you quantify that, or did you let them define what quality is? So I'm just thinking, Reagan, to your point about as we increase TRS programs, did you define quality as a Texas Rising Star or NAEYC, or did you leave that broad for parents to determine?
We let parents determine it.
Okay.
The option was literally, I want a higher quality child care center.
Yeah. Great. Thank you.
Mm-hmm.
All right, Dorothy, thank you very much. Great presentation. All right, members, our next update is from CLI, and Jennifer, I think you're here with us. This is an update on the goal and strategy about publishing and promoting updated career pathways on TechPeds.
Reagan, Jennifer is actually not here today.
Oh, it's you, April.
Yep, I'm here today, and I'm realizing that I think the slides I was asked to provide, they're related to Goal 2, but they're not the career pathways update item. They are
all right. Tell me what we're going to talk about.
Okay, and Becky, please, you jump in too, because this all kind of came from data you compiled and brought to the work group that focused on this strategy. But the update today was just to share. You can go to the next slide. We are kind of at the beginning stages of publishing on TechPeds, the Institutes of Higher Education, teacher preparation, early childhood program, degree program, certificate programs, or training programs offered by colleges and universities in the state. So right now, like as the first phase of publishing this information, it's located under a training and education area. So it's not in phase 1. The user would navigate to training and education, and then they would be able to find the search for higher education opportunities. And then the next slide, they can go through and they can pick institutes of higher education from the dropdown. So we know this isn't like the easiest way for people to find this. There's kind of a next step that's coming. But for right now, what we've done is we've taken all of that higher ed data that Becky compiled and data from another landscape. I think TWC had done some landscape work that yielded a lot of higher education details about programs and what they offered across the state. So what we've done is we basically preloaded all of that information into TechPeds for people to be able to search and find what they're looking for. If you go to the next slide, once they search for a higher ed program, they can pull up the profile for that program. This is CLI's page. for UT Health Houston. And they can learn more about the specific degree programs, any certificate opportunities, any scholarships. They can learn more about specific courses. And then once the Institute of Higher Education has published their profile through this system, that organization is also one that users can find when they're on the collaboration networking tool, the TechPeds Connect side. That college and university will now be visible as something they can view and connect with there. Then like the next slide is so right now that's the state of things. That's how you would find this. Soon we'll have more of a dedicated place where you can actually see, okay, I want to click on and view all the higher education programs in the state. So that they don't have to figure out how to navigate through training and education to get to the higher ed resources. So that will be coming future date. I don't have a date yet for when that website change will be made. And then we're also looking at to help the colleges reduce the amount of effort they need to put into keeping their profiles up to date. We're looking at which data elements we could possibly just pull from through technology, just basically pulling in data from the Texas Higher Education Coordinating Board. So there are fewer data elements that the colleges have to kind of maintain and keep current. So the next slide, this is, so where we're at right now is the data is all preloaded, but we only have 6 colleges that have published that data. So we basically, the way we're approaching this, so we don't end up with out of date information, and we don't end up with, we've basically got orphaned information out there that nobody's maintaining, is TechPeds is reaching out individually to every higher ed to identify the appropriate contact person who will kind of take responsibility for being a part of the TechPeds updating process and part of the TechPeds Connect process if potential or students, reach out to them through the portal. So 6 are already published because we've got those contacts. They've gone through their onboarding with the TechPeds team and they've chosen to publish their pages. We have 4 that are in progress. So they're going through, that technical assistance with TechPeds, and then 50 that haven't replied yet. And that's okay. This just started. So it's not like it's, it hasn't been a long time. But what we wanted to do is put together this flyer. So, particularly Becky, anybody on the call who works with colleges routinely, this flyer kind of lays out why you would want to do this, how it's supportive to the workforce, how it supports your program. And there's a little QR code down at the bottom of it that will take that faculty member, generally a faculty member probably, who's willing to be the point of contact. It'll take them to TechPeds to a ticket so they can request their onboarding support with TechPeds. So that's, Becky, do you have?
Yes, just a couple comments. That's great, all that's gotten done so far, and I think it'll be a real help. Just a few things. One, just some feedback. One is that I talked to some people that had gotten the letter or whatever, and they didn't really realize what it was. And these were even like when I originally presented this to the higher ed group, teacher ed group from the TAYC, and they all were excited about it and everything. So even I was surprised that one of those people even said, well, gee, I got this letter. What is it? Is this the same thing? So it might be that you're reaching out, but the way it's been described, maybe that they don't really recognize that that's what it is. I mean, I didn't realize you had this nice flyer here. Also, I'm just checking to see if there's a way how the searchable database is going to be, because if somebody wanted specifically an online bachelor's program, for instance, is there a way to search by online programs or by different levels of programs? Also, if they didn't really know their institution, because I know this is going to be an extremely helpful database because my colleague Amber Brown, who is my our program director, I had given her preliminary the list to start with, and she contacted several of those community colleges, and we now have about 10 affiliation agreements set up. So I think that's really important because the community colleges are getting pressure to affiliate with the four-year schools so that they can, because of some type of federal legislation that's coming down about income level of people not, people in early childhood don't, as you know, don't make that much. And programs that are where they're graduating and they don't make that much are really undergun to affiliate with a four-year school to give them the potential to go on if they wanted to. So this can be very, very helpful to your two-year schools and also the four-year schools to have, because it's all on head count. So, and the programs have been very grateful to have this information for especially the 2 years because they're really scrambling to affiliate now. So those are just some comments I have. So I think our work here is going to be very useful to people.
Yeah, that's great. And then Becky, this flyer is new because of that issue. I think when we TechPeds reached out, they didn't necessarily make the connection that this is the same thing they had heard about in another context. So we were hoping that, people who are already familiar contacts like you, if you disseminate something like the flyer, I think it will help people
That's
make that
that's
connection.
great because we do have an online higher ed network of 2- and 4-year faculty members. And if I could get a copy of the flyer, I could send it out to them to put on the listserv. So that would be great.
That sounds great. And then I can just kind of reach out separately about useful sort of filter fields, like online. I think the degree type will be one of the filters, but I'm not so sure about the online. I doubt that that's a current plan to filter. So, but I can reach out to get more information about what would be helpful.
Okay, thanks a lot. And I think that this will also because they do the scholarships for people that are working at Texas Rising Star Centers in a lot of cases through the Workforce Commission. This also can be helpful to child development centers and things too, so that they can see places that their folks can go on to higher ed if they wanted to. So,
yep.
Kirsten.
Yeah, I just wanted to commend both of you, Becky, for your steadfast research in this area. I mean, you've really led this project in a good way and helped us connect and understand this kind of universe of where there are services or where there's programs. And April, thank you and the CLI team for taking this on. I think this is a great solution. And I know we all kind of wondered in our committee, how would we keep this updated? And it looks like that you've done a fantastic job of kind of trying to get at that issue. And so hopefully the institutions that you're reaching out to will all participate because I think it's just good for all of us to have this information. So thank you very much.
You're welcome. We're glad to help. Really, it's long overdue, I think.
This one, I think, Rochelle, is the one we're going to skip and send separately, just for awareness. Another piece of goal too, that one of the work groups was focused on was putting together kind of a specialized training catalog where TELC members and work group members contributed training organizations and specific trainings available in the state that focused on things like behavioral problems, mental health supports, family engagement, and supporting kids with special needs. So our group at CLI volunteered to compile all of that information that the work group and council shared and put it into a virtual training catalog that can be disseminated. I think there might have been plans to disseminate it through the TELC's website and maybe another website. And we certainly can, it will also be available through TechPeds under the training resources. And that one also so basically it's in a format now where I think the council should look at it and see if you're ready for us to publish. Yeah, but I didn't necessarily want to share it here. I've realized too late that y'all,
So we can
put it out there already. Y'all might want to look at it in the notes yourselves.
we can send out additional information on that.
We can. Yep, I'll send
Yeah.
a follow-up.
And perhaps we can also send out a copy of the flyer.
Yep.
That was great. Echoing what Kirsten said, Becky, thank you. I love that you have spearheaded all of the work in this. And April, of course, thank you to your team for, taking action on Becky's recommendation. I think this is a great addition into TechPeds and has a lot of value. So Becky, thank you very much.
You're welcome. And one thing about higher ed helps everybody, because, so this helps all our people and all the things that we've been talking about today. The more training and more education that our people have, the better.
Absolutely. Absolutely. Okay, and then lastly, Rochelle is going to discuss a couple of strategies that were assigned to the Texas Early Learning Council around sharing data and family engagement, and some discussions that the Early Childhood Interagency Work Group has had about these items. Rochelle?
Yeah, thank you, Reagan. As Reagan mentioned, we have, we meet monthly with the Early Childhood Interagency Work Group, and we're also looking at the strategic plan, looking at those items that are assigned to us or our programs individually, but also looking at the bigger picture. And in looking at some of the things where we had initially identified TELC as the primary responsible party, we were brainstorming ways that we can be good collaborators and supportive of that work. Maybe not in exactly the way it was originally envisioned, but at least in some form or fashion that sort of supports the spirit of these particular items. And so the first one was sharing data and trends and resources about early learning services supply and demand. I think ultimately the vision is that ESIDS will do a lot around that issue, but it's going to take a while to get there. And we were thinking and wanting to suggest to this group that perhaps our agencies as well as non-agency TLC members could compile a comprehensive list of all the different data sources we have regarding early childhood services, families utilizing early childhood services, and post that maybe on the Texas Early Learning website as a one-stop shop. Not that we would take that data and put it all there, but we'd have links. Sort of like, okay, these are all the different things that, for example, Texas Workforce Commission has, and it addresses data on X, Y, and Z. And then, childcare regulation. These are the data sets that they have that look at these things. It seems like it would be relatively easy short-term a way to address this. And so we just kind of wanted to present to you guys, get your thoughts as a larger group. If you have concerns that this isn't where we would want to head, and B, to kind of find out, yes, I think my organization has some great places where we could add to this list of data resources. So just kind of open it up briefly for a conversation. Yes, Kim.
Thanks, Michelle. So just clarifying, this isn't in replace of, just as we continue to build ESIDS, and what can we do as a stopgap until we get a little bit further down the line on that piece.
Yeah, absolutely. Just to show some progress that is tangible. Not that ESIDS development so far isn't tangible, but I think for the average person being able to see, oh, look, there is this information out there.
And I think the other, I think where that lives, I think depends on who we want the main audience to be for it too, right? Like if it's supposed to be more parent facing, then maybe not the Texas Early Learning Council, which they don't know we exist, and maybe more of that parent website. or if it's really for, the more of us, then Texas Early Learning Council might be a good place for it to go. And so I don't know if I have a strong opinion on that piece, just thinking about who we want the user to be. And really, any of us will go wherever it's at, right? So we're the easy ones to train. So I put easy in quotations. And yeah,
Yeah, because I mean, it might be that once we get it all sort of compiled, it might make it may be really clear. Oh, this researchers are going to be the primary audience for this information, for example. Or it
right.
may be that it lives on TELC, but we link it in multiple other places that where people might have some interest.
Yeah.
So just food for thought and what we can do is the state agencies have kind of sort of compiling some of this. Happy to present a draft of that to you guys to kind of look at what we're thinking and discuss further if we need to. Stephanie.
Yeah, I was just gonna, I think you're drafting what options would be good, would it be helpful because it's, like what are the standards of data that would go on there? Is it a data set but without any analysis of it? Is it a link to where to find, people might find things on websites? Like if you're taking data from community sources as an example, there might need to be some effort to have some like data rules around what should make it on that site. And who, because I do think it's possible to look at data and for people to not understand what it's reflecting, or, data analysis can have a perspective. And so just kind of maybe there's a conversation about what should be highlighted in that forum, I guess. And there can be links to other things. I would just want to be a little bit, not careful, but kind of go through it with some standards of what we think would be helpful. And I guess, one of the upsides or downsides is people will see that there are a lot of data available in different ways, and things that they had no idea existed, which I think would be good. And as there is a discussion about whether data systems speak to each other, like this would also potentially be a good example of how it's a little bit all over the place, and what would be what is a way to reflect early childhood system data that's very useful, whether it's for families or researchers or policymakers. Or I think it's a great discussion to have, and these things you probably talked about in ESIDS, but I don't know that we've gotten in great detail about like other sources that would be good for people to have access to.
Yeah, absolutely. I think there's a lot, and what, like I said, I will forward out to members, kind of the draft, and like I said, it's very drafty. And really, I think we're focusing a lot more on raw data rather than anything that offers an analysis. And so just kind of keeping that in mind. So okay, well then I will get that out to you guys to take a look at, and maybe we can bring it back for discussion next time. The other thing I wanted to talk about is another conversation that we've had on the work group related to some of the family voice and highlighting and promoting family voice. I think we have figured out that a lot of our agencies are doing a lot of things that could sometimes offer ideas, suggestions, inspiration to others in the group. And we were wondering if there might be some benefit toward meeting some of these goals if we each of our organizations, agencies took some time in our meetings to bring up, hey, here's what we've done in the last quarter or last 6 months, whatever time period, and just kind of share out those good practices and remind us all where those opportunities for family voice can continue to move us all forward. We're thinking it'd be some sort of a rotation. Obviously, if it wasn't on, your rotation and you did not have something significant to share, just pull in the next person and see if they do. So it would not be a forced, you must present something. But we were just wondering if that might be a good, little bit of a feel good, honestly, direction to take. And so in a little bit, just to kind of test the waters on this a little bit, we've got Family Support Services is going to be providing something similar to what we envisioned it could look like. So just kind of be mindful of that when we get to that point of the meeting. But I just want to kind of get everybody's initial thoughts, ideas, concerns around this approach.
I love the idea. I would add, and maybe it comes up in things coming out like TELC announcements, but when there are upcoming opportunities for family engagement, whether it's through a commission or a task force, or someone's going to be doing a survey, that might be helpful to share too, so that we can leverage each other's family networks to try to get the most feedback as possible.
Absolutely love that idea.
This is April. I'd also be happy to share if the council's interested. CLI is in the pilot phase of a project that TEA is funding. We're developing a family engagement survey that schools, childcare, it's designed to work across settings, childcare, Head Start, public schools, regardless of age group, that programs can send out to their families to learn more about how families are feeling about engagement and support they're receiving. It actually dovetails nicely with a lot of the constructs Dorothy was talking about in terms of parental support. So I'd be happy to share, and that survey, it will be freely available for anybody to use once it's published. So I'd be happy to share like what we learned from the survey and also the instrument itself, if there are others who might want to use it or encourage providers to use it.
Can I ask a question about that, April? So are you saying that you would set it up in some sort of survey tool and then anybody could send that link? Or would it be more like, oh, here's the questions and you guys can...
It's actually both. What TEA has funded, CLI has a family engagement toolkit already on CLI Engage, and it includes, a lot of helpful training and information for providers and teaching staff around how to effectively partner with families. And we've created a survey essentially that allows childcare providers, public schools, anybody to survey their families to learn more about how well they're doing in those areas. And then the reporting that comes off of CLI Engage, once they collect that data, if they choose to do it online through Engage, they'll get a feedback report that gives them recommendations for sort of like, what are the key insights and areas where you could focus on improvement in your family engagement strategy. But users could also just use a paper pencil version of the survey. But Engage will be capable. All schools who use CLI Engage, at no cost, will be able to launch the survey themselves. So we're hoping it's going to be a nice way for childcare providers, public schools, Head Starts to learn more directly from their families about how things are going. And we're hoping the feedback report will really help them improve practice.
Awesome. Okay, well, so if we don't have any major concerns about this sort of incorporating family voice on a regular basis, I'll start working on some mechanisms that we can pull that together. And then I actually want to turn over
Rochelle, I'm also the next act. We are already at 12:23, and I'm wondering if we should postpone discussion on the next item until the next meeting. In an effort, I know we have several updates that we need to get through. So
yeah.
Okay.
Yep, I can, Megan, we'll circle back and get you back on the agenda for that one, okay? Okay.
All right. So moving to updates from council members, we have several today. The first that Rochelle mentioned is incorporating family voice. And so Anjali Bonilla from Family Support Services is here.
Is she?
Is she? We cannot hear you.
Is she, Kathy, can you double check and make sure?
She needs to be presenter mode.
We'll get you promoted, Anjali. Give us a second.
She should be good to go.
Are you there?
Yeah, I think I made it into presenter mode. Thank you.
Yes.
Great. And then should I share my screen, or Rachel, you might.
I've got your slides if you just want me to walk them through.
Yeah, that was perfect. Thank you so much. Well, good morning, everyone. Anjali Bonilla, Director of Programs at Family Support Services. And here at Family Support Services, we truly, truly believe that Family Voice should help shape the work, right? And not just be a checkbox. And we're still learning a lot. And so we'll just share a few examples from our work. If you want to go to the next slide. Really briefly, if you're not as familiar with Family Support Services, we really promote healthy families and communities. So there's two pieces to that, right? Like families and the services to families, but then also strengthening the community. All services are free and voluntary, and you all are familiar with those, from home visiting to parent education, but really supporting parents and youth. And our links are there. And you can go to the next slide, Rochelle. I will say one of the really key pieces is we have a Family Support Services parent on staff. And I will say that she is amazing, and just like this heartbeat in the background that has us really saying, remember Family Voice, remember Family Voice. She just serves on different interagency task force and really helps bring that reminder that Family Voice is so important. We also have some structures, and I think that is a key piece, having structures in place that you have. So we have a parent advisory committee at the state level. We also have a youth advisory committee. I'll show you who those folks are a little bit in a minute. And then at the local level, really surveys, the same surveys through all of our 9 FSS programs, really asking, how was your experience in the program? What can we do better? And we even look at this as a whole, about 80% staff of what are parents saying. So it really brings that back to us. And then also really at the beginning, right, of the grant process, we have a community strengths and needs assessment that folks submit. And so really encouraging that family and youth voice while programs are being planned and implemented. So that's really like a grounding factor. And then really another place is our family resource centers. So we have really hallmarked that one of the foundations of our family resource centers is that parent leadership, parent voice. And then at the local level, also lots of local parent and youth advisory committees, just a growing number of those really in the last several years. So if we want to go to the next slide, we'll be able to see the picture of our 9 different parents. They've been previous program participants. They have kids of all different ages and are just really excited to contribute. Really, they've contributed to our strategic plan, to on different outreach materials, and they aren't shy in giving us feedback. And we just really embrace them and truly appreciate all that they have to bring. And you can see on the next slide that really representation from all different areas in Texas and all bringing their perspectives. They meet virtually, and then also at least once a year, we'll get together in person as well to meet. So having the structure in these folks that we can, if we have a question, we can have them answer it, on their platform that they give feedback on also. And so then we'll kind of keep going to the next one of just different things that they provided feedback on. I mean, are any videos that we do or outreach materials, just are, the photos resonating? Is the wording, should that be changed? Some have been part of panel discussions as well. And then just also engaging with us on how can we make the forms that we have also just more parent friendly, or if there's a question that we have to keep helping, like how do we explain to other parents that this is information maybe we have to ask because it's required by a grant. So they've been really helpful in that aspect. And we can keep flipping along. That we also, as part of the Family Youth, that another structure, our Community Youth Development Program, has really baked in Youth Advisory Committees. So they're really charged with helping plan programming and often included in needs assessment work, and even really trying to tackle big problems that they see as a youth. So we've really embraced that committee and at the local level. So at the state level, we have youth ambassadors as well, 11 from across the state. So providing input, like that survey I talked about earlier, we asked them help with the questions, like do these make sense to you? How can we help? And aside from them getting input from them, we've really seen just a growth of these leaders. We have some that are graduating. We sent them graduation cords from FSS, and it's really been a leadership development opportunity for them. So it feels like they have grown too, and it's not just us, that we're getting all this great interaction and information from them as well. And so we can flip to the next one of some social media graphics that were developed a few years ago. And this is back when we were at DFPS, but it was what really would you as a youth want to tell adults in your life of what it's like being as a teenager. So I'll just read one of those of find that person or group you can really relate to. Don't be afraid to communicate with staff. And then the other one, just some parents are scared to let us try new things. Let go a little bit and trust us. That's how we build trust between parents and teen. They should also be able to share their opinion and have it respected. Stacy. So it's just really cool to hear that voice coming through. And then we'll flip to the next one, one that we've talked about, the preschool development grant. So I will just point out that that's one thing that really just accelerated parent voice at the table. Just one example here you see from United Way San Antonio is having a conference of leaders, of parent leaders coming together to really help build them up in their leadership opportunities. And then we can even flip on to the next one of just things that we've learned, that every community is different in how they form their packs, of who joins. We've heard that, having childcare while they're on site has been a helpful recruitment strategy. Sometimes folks are wanting to grow their leadership skills, so that's been something that has attracted them to being a parent leader. And then at the state level, we've learned that there's not a great one instruction manual that someone can pick up of how do you do this? How do you do a parent advisory committee? So just we want to embark on having those groups come together, like the folks that are actually doing the work and running the packs, to really learn from each other. So that's really what's ahead for us. We're continuing to learn, continuing to figure out how to incorporate family voice in everything that we do. And then I think that really wraps us up. That again, we're just still learning, and we're trying not to have it be a checkbox in any means, but really just how does it continue? Everything just shape the work. So thank you all.
Members, questions or comments? I feel like you guys, you say you're just learning, and I feel like we have so much to learn from you because you guys really have a robust system for family engagement.
Thanks.
All right. Thank you. Our next update, we're going to hear from Monica Martinez at TEA.
Thanks, Reagan. So I just had a brief update, and certainly in the interest of time, I think most folks know that the Governor's Task Force on the Governance of Early Childhood Education and Care is now well underway. I wanted to specifically shout out the members of this council who presented at the first formal meeting a couple of weeks ago. Also wanted to highlight that the task force has a web page. So the link is here, the URL, excuse me, here is here on the slide. You can also go to the TEA website and type in Governor's Task Force, and it's the second or third item that'll pop up. But this web page is intended to keep everyone abreast of task force activities. So from that web page, you can go, if you're not sure who all is on the task force, there's a brief bio of each task force member. We are also publishing materials related to meetings. So at that first formal meeting on March 31st, we had a number of presentations, both from state agencies as well as other invited testifiers. We are still in the process of uploading a couple of slide decks, but that is a place where we will make information available for anyone who is interested in going back and accessing that or following along. We will also publish future meeting dates. The chairman is in the process of trying to finalize the rest of the dates between now and I believe October-ish. We do expect the task force, excuse me, to meet about once a month. And then finally, one thing I wanted to draw folks' attention to is you've got to scroll a little bit, but at the bottom of this page, there is an opportunity for anyone to provide input or feedback to the task force. So we're collecting that written feedback and passing that on to task force members as it is received. So those are a few things that I wanted to highlight. I also wanted to mention that for anyone who didn't attend the last meeting, one of the items that came up where there was I would say a pretty significant amount of interest is the eSIDS project. And so we do anticipate that we will be providing some additional updates to task force members at their next meeting, which I should mention will be on April 30th. And just for members of this group to be aware, we are making some good progress trying to make sure that we've got all of the internal agency agreements in place in order to be able to move forward with the different aspects of data sharing. So it may feel like there's not a lot of activity. There is quite a bit of activity happening at the state agency level. And we will be providing additional updates both to the task force and to this group as we have more substantive updates to provide. So stay tuned on that. But I think those are the brief updates that I have related to a couple of our legislative mandates. Don't know if there's time for questions, but certainly happy to try and answer any if there are.
Members, any questions or comments?
Monica, this is Stephanie. So just to clarify, at the meetings, there is not public testimony, but there's the ability to submit written testimony. Is that correct?
So for the first meeting, they limited testimony to invited testimony.
Right.
I don't yet know what the agenda will be. I anticipate that the task force will, at least one meeting, invite more general public testimony. But we wanted to make sure there was an opportunity for feedback and testimony throughout the process. And so we created this link. It's a brief form that anyone can fill out. There's the ability to include attachments so that there is a mechanism in place for task force members to receive input throughout the process.
Okay.
All right. Thank you, Monica. We have a second update from TEA. Mandy Young is here with us to give us an update on House Bill 2310.
Okay, thank you very much. I can either use this slide deck or share my own, either way.
Let's use yours because all I have is this slide.
Oh, okay, great. Then I'll share my screen. Hey, are we seeing my screen okay?
Yes.
Thanks, Rochelle. All right. Thank you all for being here today and for your commitment to young children and families across Texas. My name is Mandy Young. I'm a special education technical assistance manager at TEA. And one of the work streams that I oversee is early childhood special education, or ECSE. And today I'm going to walk through House Bill 2310 pretty quickly. It was just passed through the most recent legislative session, and it directs state agencies to work together to improve early learning opportunities for young children with disabilities and developmental delays. So I'm going to share some background about the required elements, but just as importantly, is hearing from you guys. So there are going to be several moments for discussion, and your comments will help inform this strategic plan. Be ready to jump into chat, unmute when prompted. If you can't access the chat or we don't have enough time to get through everything, that is okay. We have an email address that you can send questions and feedback to. It is strategic plan hb2310@tea.texas.gov. And I have, at the end of this presentation, I have that on a slide. So let's get started. So here's what we're going to cover, the purpose of the bill. And then we will be going through, the purpose of the House bill is 2310 is to improve inclusion for young children with disabilities and those developmental delays. So in early childhood settings across Texas. So we want to ensure that applicable state agencies work better together rather than separately. So I want to take a moment to explain how the bill asks us to do this work. House Bill 2310 requires a 4-year strategic plan developed together by TEA, HHSC, and TWC. And the emphasis here is on coordination. We're making sure that these systems are working together more intentionally to support those young children with disabilities or developmental delays. And at the center of this plan is the idea of improving early learning opportunities and creating more seamless experience for families from birth through school entry. And when we talk about this kind of coordination, what we're really talking about is inclusion and making sure that children with disabilities or those delays can participate meaningfully in that early childhood setting, and that families don't experience those unnecessary gaps or those barriers along the way. So before we go any further, I want to pause to make sure we're all grounded in what we mean by inclusion. So there are many formal definitions of inclusion across education, health systems, but for today, it's important that we operate from a shared understanding of inclusion. And so for this discussion, inclusion means that young children with disabilities or developmental delays learn, play, and participate alongside peers of the same age without disabilities, with the supports and services they need to fully participate. And this definition is important because it frames inclusion not as a separate placement or a special setting, but as belonging in everyday early childhood environments, childcare, pre-K classrooms, and community settings. So with this definition in mind, I want to bring this concept out of policy language and into a real-world context by introducing a family whose experience can help guide our conversation. So I'd like to introduce a family, the Martinez family from Anywhere, Texas. And this is a fictional scenario, but it reflects real experiences from families shared across our state. So a Martinez family has 3 young children, and their oldest has been diagnosed with autism. And the parents have concerns about another child as well, their second child. And like many families, the mom wants to return to the full-time work while still navigating assessment services and all those care options for her kids. And so as we move into discussions about these barriers and strategies, which we've already discussed a lot about today, it's been very helpful. I'd like us to keep this family in mind, but not as a single case, but as a representative of many of the families that we're trying to access inclusive early childhood opportunities in Texas. I know you might have questions about Martinez family, but I'd like you to take a moment and think about what inclusion would look like for the Martinez family in a real life based situation that I've shared. So there are no right or wrong answers. We're just here to brainstorm. Please use what you know from your work or your even personal knowledge. And if you feel comfortable, share out an answer in the chat or unmute. What do you think inclusion would look like for the Martinez family in daily life? And remember, inclusion means that Martinez family gets the support and services they need so they can take part in the same programs as their peers with disabilities. And let me know what you think it might look like in areas of their lives. And I'm going to give an example. So if a school is hosting a parent meeting, like family engagement activity, does the school provide childcare so that the parents can engage, fully participate in that meeting? Something like that. And I see that chat is coming up. They can find the childcare that they need. Yes. Any other ways that the Martinez family might look like they have inclusion? And you can even think about a time that you worked with a family or that your family was just first starting and trying to get support for your child. And what stands out most about that time regarding inclusion? We talked a lot about this in when we discussed some barriers with Dorothy and Tessa, and Lacey also brought up some information about this. So they have the support in the child care center to learn and develop. Yes, we talk a lot about training for the teachers, ensuring that they know how to work with students with disabilities and developmental delays. Okay, just to get you thinking about that, I'm going to move on to the next part. So House Bill 2310, it's very specific about what has to be included in this strategic plan. And so we're required to include strategies for the inclusion of children with disabilities and delays. We're supposed to describe existing barriers to the effective inclusion of children with disabilities in early learning programs, and then make recommendations for improvement, as well as recommendations to improve provider staffing, training, sustainability, and effectiveness across public schools, childcare programs. So this is why today's discussion, especially around barriers and solutions, is so critical. Okay, now that we need to identify those barriers in the strategic plan, let's catch up to the Martinez family. So based on what you know, what are the main barriers to inclusion that the Martinez family might face? And remember, if you feel comfortable, just come off mute. Not knowing what resources are available, as someone said in the chat. We heard a lot about barriers from Lacey and Tessa at the very beginning in the public comment. Dorothy had a lot to say about barriers as well around stress. So that's right. The training, for instance, if there's available training for the 2.5-year-old's childcare providers around how maybe his possible autism might impact behavior and progress in the classroom. And that training may be really important for those childcare providers who've never worked with a child who has characteristics of autism. So wait times to get services is another barrier. Any other barriers that you have? Transition from a very inclusive environment into a system that's less inclusive in another setting. Those transitions are super important, and that ECI to ECSE can be a barrier if we don't have the right systems in place. Okay, and just a reminder, if you have more, you're thinking about this later, please send us an email through the strategic plan, House Bill 2310 email that you're going to see. Okay, so now we surfaced some of those challenges. I want to pause and ground us back into what the bill itself requires us to address again. It doesn't start from a blank slate. It outlines specific strategies, recommendations that the strategic plan must include. So as we review these required strategies, I encourage you to listen with two questions in mind. First, do these recommendations reflect the barriers that you're seeing in practice? And I might just drop these in chat. The second question, where might there be opportunities to strengthen or build on what's already outlined here? So let me drop that in chat. So thinking about these two questions. So with that context, let's look a little closer into the recommendations that are written directly into the bill. So at a high level, the bill focuses on strengthening the systems that families and providers rely on every day. And that starts with improving provider staffing, training, sustainability, and effectiveness across public schools, in childcare programs, early childhood intervention services, all of those areas. So another major emphasis is making better use of existing funding and resources. And this isn't just about finding new dollars, but about coordinating what we already have in smarter and more aligned ways. And the bill also calls out the importance of streamlined transitions for families, especially during some of the most challenging points, moving from ECI to ECSE, and then from ECSE into school age services. These transitions are often where families experience a lot of confusion, and we talked a little bit about that at the beginning of this meeting. But that's where that confusion comes in, those delays, the gaps in support. And finally, there's a strong focus on improving collaboration and partnerships across early childhood programs, those intervention services, public schools. Inclusion can't happen in isolation. So it requires that shared responsibility. So many of these recommendations reflect work that's already happening across Texas. And what this strategic plan aims to do is to bring those efforts together and create alignment and strengthen them so that they work better for the families, like the Martinez family. Okay, so we know what has to be included, what absolutely will be included in the strategic plan. Those things will be, but at the same time, we know that policy language doesn't always capture everything that's happening on the ground. So families, providers, educators, advocates, they often see solutions and opportunities that don't neatly fit into statute, but still make a real difference in daily life. I want to pause here and turn that conversation back again to you. So thinking about the Martinez family and families like them across Texas, are there other strategies, practices, supports that could strengthen inclusion in everyday early childhood settings? Remember, you can come off mute. This might be something you've seen work in the past, you wish that existed, something we could build on. What do you guys think? Okay, I'm not gonna stay too long, but if you do have something you want to put in the chat, please do so. We'll monitor it. And remember, also send us that email back to the strategic plan, HB 2310. Okay. So as we move from that discussion into action, I want to share how you and others across Texas can continue to be involved in shaping the strategic plan. So to ensure we gather broad and meaningful input, House Bill 2310 requires multiple opportunities for stakeholder feedback, this being one of them. But the primary way that we're collecting feedback is statewide is through a survey. And this survey is designed to capture perspectives from families, educators, providers, advocates, partners, anyone across the system. And it allows us to hear the voices we may not reach through these meetings and help ensure the strategic plan reflects all those experiences, not just who's in this room. So the survey is designed to capture those experiences from families and educators, and your feedback is going to help us identify these barriers and highlight what's working and shape policies that support inclusion between and transition between programs. So our biggest ask today, it's simple but really powerful. Please take this survey and share it with your professional and personal networks. The survey is anonymous. It takes about 10 to 12 minutes. It launched today, just launched today, the 17th of April, and will remain open until May 3rd. So to protect the integrity of the data, and I think Dorothy talked about this too, we don't want any bots interfering. We ask that you not share this on social media, but direct sharing with families and providers is strongly encouraged. And remember, you have a copy of these slides, and you can access the QR code and link to the survey after the meeting to complete the survey yourself. But our biggest ask is please get this information out there. Okay, so in addition to the survey, we're also gathering feedback, one of which is today's meeting. We will also be discussing this at the ECI Advisory Committee meeting. And we'll have both parent, provider, and provider focus groups that are coming up. So the goal is to capture perspectives from everyone. And so as after we gather the stakeholder feedback, TEA and HHSC and TWC will finalize a 4-year strategic plan, which must be published by September 1st of 2026. And feedback summaries will be included with the plan. So we'll also develop a communications and sustainability strategy to help keep this plan relevant over time. And we are partnering with UT Austin's Texas Institute for Child and Family Wellbeing to support the research and writing, and we will have more information on that. So that brings us to the end of this, and we truly value your perspectives. So I can leave it open for questions or comments. I know we're short on time, but lastly, please email us at this email if you'd like to give us some feedback. Thank you, guys.
So Mandy, we have one question in the chat. Will there be an opportunity for feedback, especially by families on the draft plan?
Yes, there will be. We have a focus group that is being put together currently. So we'll have an opportunity to speak with parents in this focus group, as well as through the stakeholder engagement survey that we're sending out. We have specific questions for families on the survey as well.
This is Stephanie. I was asking about like when you have draft recommendations to get feedback on any of those. Like, is there a follow-up opportunity for the focus group, or we could help with that too if you want some feedback?
Oh, thank you, Stephanie. Yes, we will take you up on that offer. We don't have a plan right now, but I would love to talk with you more about that.
Okay,
yes.
great. Thank you.
Wonderful.
Great job. Thank you, Mandy.
Mandy, thank you for the update.
You're welcome.
And we also received a message from the Chief of Staff for Representative Ordaz, who passed this legislation, offering any assistance that they can provide. So thank you for joining us today. Mandy, thank you very much for that update. Members, I told you we had a very packed schedule, and we really do. So Stephanie has graciously offered to delay their presentation until our next meeting. That will ensure that we have enough time to thoughtfully consider what she has to say and have discussions. So with that, I'm going to go to a couple of updates from TWC, and I know my folks will be quick with these. We have 2 updates, one from Rochelle on the Quad Agency, a second from Kathy Arwood on a new grant program that we have. Rochelle.
Yes, I will be quick. So the Quad Agency Commission had our second meeting on March the 24th. And at that time, we did initiate a review around the collection of data on pre-K partnerships. The briefing paper that we used to sort of kick off that review can be found on our website, also directly at this link. The background is that both TWC and TEA house information or collected data regarding pre-K partnership participation, and we've got stakeholders interested in more local education agencies engaging in these private partnerships with childcare providers. So we really feel like accurate data is needed to make sure that the state as a whole understands our landscape, and this is open for comments through April 24th. And there's the email you can send comments to. Oh, I'm not sharing. Oh my gosh. Okay. Sorry, guys. I selected it. I must not have selected the right one. Okay. Okay, there you go. So yes, here's my screen. Sorry, I'm not going to repeat everything I just said, but it is there. A link to the briefing paper and a link to comments. And I think Kathy's going to drop those in the chat too.
Okay, and Kathy Arwood.
Okay, good afternoon. So, in response to what we've heard from families and childcare providers about the need for increased training and assistance for supporting children with developmental delays and disabilities, we heard a lot about that today. So TWC is excited to announce that the launch of our ELITE initiative. So as you can see, ELITE is Early Learning, Inclusion, Training, and Education. The primary goal for this initiative is to provide technical assistance to the local workforce solutions staff, and they're the ones that implement the Child Care Services program. So this will support them in supporting the inclusive care for children with disabilities, as well as those that are exhibiting challenging behaviors. TWC awarded the grant to Child Care Group, and right now they're meeting with the Child Care Services staff to better understand their needs at those local offices. And we'll also definitely want to share Dr. Mandel's findings that we heard today to help inform their approach. So once we get those published, we will be sharing that with the group. And I also want to mention that while the primary goal is to support the Child Care Services staff at those local workforce boards, ELITE will also provide training and resources for child care providers. So stay tuned on that.
Thank you, Kathy. All right. We had an update from ECI as well.
Sorry, yeah, I think I can be really quick on this if we just want to go to the next slide real quick. So this is just a follow-up to what I talked about in our last meeting. This slide shows the different trainings that ECI developed with TWC and with the HHSC childcare regulation, that we have the decks and talking points for local ECI programs to deliver these trainings in childcare centers. We're working to update them since they've been around for a few years now. And then we'll be sending out the updates and posting new recordings on our website. And if you could go to the next slide. Last quarter, we had a question about where trainings had happened so far. So since 2022, we've had more than 1,500 childcare programs across over 250 cities participate in a training, and this shows just a dot for each place. We didn't have the data to kind of create a true heat map, so it's just a map. But you can see that the dots kind of align with where the population of the state is, right? So you can see that we've really covered population centers across the state. And then I also just wanted to note real quick, I don't have a slide for this, that HHSC is submitting an application today to the 0 to 3 Infant and Early Childhood Mental Health Financing Policy Project. And through this, we hope to build on some of the Preschool Development Grant, Infant and Early Childhood Mental Health Consultation work, specifically leveraging the sustainability roadmap that was designed by the Texas Institute for Excellence in Mental Health. And I know it's 101, so I won't tell you guys everything about that, but if you have any questions about that, please feel free to reach out. We should find out on May 1st if we're selected to participate.
Well, that's fantastic. We can see if we can get an update on that at the next council meeting. And as a reminder, TWC also applied for and received some federal funds to extend the infant and early childhood mental health. So that would build upon those funds that TWC has already provided. All right, Kim. Kim was also going to provide an update on childcare deserts. And oh my gosh, once again, it's already 1 o'clock.
It's right. Too much data, too much information. I just dropped a link in the chat. We have we've updated our childcare deserts like we do every year. So you can find the interactive map at that first link. We have added a new layer this year looking at chronic childcare deserts. That's a desert that's been a desert for at least 3 years or more. Now that we've been looking and we're far enough from the pandemic, we can get some true data. So that's another layer that you can link into. And we're in the middle of doing our virtual Texas tour. We're coming to a city near you. So there is a link there that we will dig into those deserts and other data specifically for those communities. So join there and I'll present more details at a future meeting.
Yes, next meeting. We already have a lot of stuff on the agenda for next meeting as well. Okay. Any other updates that members need to share? If not, we go to upcoming early childhood events. We have a couple that are listed on the slide that we don't really have time to talk about. You can read.
Real quick, want to flag, like Mandy mentioned, that if you had additional comments you wanted to share about the strategic plan and you want to do those live in a meeting, in addition to the survey or email, the EC Advisory Committee is another opportunity on April 29th to participate in a discussion or provide public comment for the House Bill 2310 strategic plan.
Good note. All right. Any other events? Okay. That takes us to the end. A reminder of when our upcoming meetings are. Before we adjourn, does anyone else have any comments that they need to make? Okay. It is 1:03, and amazingly, we are only 3 minutes late. Thank you, members. This was a great meeting with a lot of information and a lot of good discussion, and more to come at our next meeting. Clearly, we didn't get to everything we wanted to talk about. So thanks to everyone for your engagement. It's now 1:04 and the Texas Early Learning Council meeting is closing. So thank you all. Thank you to the guests who joined us.
Thanks, Reagan. Thanks, Rochelle.
Bye.